Me join this afternoon's session. I'm Erynn Johnson. I'm a policy officer within the New South Wales Ministry of Health's new Climate Risk and Net Zero unit. Firstly, I'd like to add my acknowledgement of country, acknowledging the traditional custodians of the land on which we are meeting today. For myself, that's the Camaragal people. We honour the ancestors of yesterday, the custodians of today, and those of tomorrow. We recognise their continuing connection to land and waters, and how culture is held, nurtured, and shared, and that the principles of stewardship and caring for country are important guiding principles in New South Wales climate risk response. In today's presentation, I'd like to provide an overview of what our climate risk and net zero unit is doing, what our core responsibilities are, and how we plan on supporting New South Wales' transition to a low carbon, low waste, climate resilient system. Firstly, I'd like to start with the fundamental principle that guides our unit's activities, and that is that climate change is a substantial health issue. This comes as no surprise to all of you who are joined here today. However, fundamentally, the changing climate is increasingly having substantial impacts on health and our health services. And we observe this through not just only the direct impacts of the increased frequency of severe storms, which have recently devastated some parts of our northern New South Wales communities, but alongside flooding, bushfire, and extreme heat events, which are particularly significant challenges for our Western Sydney urban populations. Alongside this, we need to consider the shifts in infectious diseases, rises in allergens, food and water insecurity, forced human migration, civil conflict, and mental health impacts. We understand that these impacts are not equally distributed and are in fact disproportionately impacting our most vulnerable cohorts, including our elderly, our Aboriginal communities, our rural and remote communities. And there is overwhelming scientific evidence that climate change is supercharging our climate, with the latest IPCC report stating that we need to rapidly reduce emissions this decade across every sector, including within health, to avoid catastrophic climate breakdown. There's a comprehensive suite of existing climate change policies in place within New South Wales, including the New South Wales Government Net Zero Plan, which is the foundation for New South Wales action on climate change and the goal to reach net zero emissions by 2050. The New South Wales Government has established two clear requirements for us. Firstly, we are required to address our transition risk and decarbonise health. And secondly, we need to adapt to physical climate risks. We know that the health system itself has a substantial carbon footprint because globally we're part of the problem. If the health system were a country, it'd be the fifth largest source of carbon pollution on the planet. We as a system use huge amounts of resources, we produce vast amounts of waste, we continue to use fossil fuel energies, and within New South Wales, it's modelled that the health system comprises 7% of the state's emissions and 8% of the state's waste. Health has the highest greenhouse gas emissions of all New South Wales government clusters. With that, we have a substantial carbon footprint and a responsibility to reduce our emissions and transition to net zero. What are we doing about it? As a high emitting sector, health is committed to the New South Wales Government targets and to reducing and meeting and exceeding the goals across Scope 1, 2 and 3 emissions. Under our Future Health Strategy, New South Wales Health is committed to delivering an environmentally sustainable footprint for future healthcare. Whilst we understand this responsibility, we also recognise that there is a tremendous opportunity to improve health and the human experience of healthcare, because so many decarbonisation activities are so well aligned with our other future health priorities, including elevating the experience of our staff and our consumers, virtual care, and value-based healthcare. Research shows that more than half of the health system's carbon footprint is from clinical care, which includes pharmaceuticals, medical devices, equipment, food services, and so on. Within New South Wales Health, we have made a start to developing a climate risk response, and a new unit has been established to work alongside our colleagues within the energy, infrastructure, fleet, and procurement teams who have been making steps in this direction for some time now. We've recently released our position statement, which is publicly available on our new website, and this provides an overview of our unit's priorities, including our core responsibilities and priorities of metrics, developing low carbon models of care, and staff engagement. We have a shared vision for New South Wales Health to be a leading, modern, low carbon, low waste, climate resilient health system by focusing on innovation, value, quality, and equity. Much of our existing units activities are in fact modelled on international best practice, which includes the Greener NHS's program, and they're focused on sustainable models of care, workforce, networks, leadership and metrics. We're concentrating efforts on establishing the right structures and governance and identifying the appropriate levers, which includes policies to support our response. Our unit's activities are overseen by our Environmental Sustainability Steering Committee in partnership with our local health districts, sustainability networks, and our specialty health networks, pillar organisations, and other New South Wales health entities. We're also working alongside our external stakeholders, including the Office of Energy and Climate Change, which sits within the New South Wales Treasury Cluster. There are many staff across the system who are acting to improve patient experience and reduce emissions in a range of initiatives, which includes using less polluting anaesthetic gases, to reducing single-use plastics in theatres, repairing and reusing mobility aids, and a range of food waste reduction initiatives. You've heard about some of this great work earlier today from colleagues at Hunter New England Local Health District, the Sydney Children's Hospital Network, South Western Sydney Local Health District, and the Nepean Blue Mountains Local Health District. We recognise that these changes will be required across the system to decarbonise health, and that much of this work will in fact be led by our frontline staff. As such, we've recently established a Net Zero Leads program where we're supporting 10 of our senior clinical staff across nursing, allied health, and medical professions to redesign and reimagine their service or specialty through a net zero lens. These leads will act as change agents for the system and lead a network of like-minded peers working in partnership with researchers to measure the carbon costs of their investigations, procedures, services, and clinical pathways to develop and implement scalable, low-carbon models of care for New South Wales. We're also undertaking comprehensive carbon footprinting of one metropolitan and one regional-based hospital in partnership with our Nepean Blue Mountains and Northern New South Wales local health districts and the Office of Energy and Climate Change, alongside our expert carbon footprinting consultants, 2XE. As part of our commitment to scale up and coordinate environmental sustainable action across the public health system, New South Wales Health recently joined as an official member of GGHH's Pacific Network alongside the Victorian, Queensland, ACT and WA departments. We understand and appreciate that Australia is one of the countries at the front line of climate health impact, so our health services and systems will have to become prepared and resilient to climate threats. We need to build resilience and adaptation capability across our systems, workforces, services, supply chains, and infrastructure so that they're prepared for the climate impacts that are baked into the system for decades to come. The New South Wales Government has recently released its Climate Change Adaptation Strategy, which builds upon the New South Wales Government's Net Zero plan, and this will guide our adaptation response, prioritising climate change risk metrics, the development of change risk and opportunity assessments, the delivery of adaptation action plans, and climate change adaptation being embedded into all New South Wales Government decision making. Whilst we recognise we have made a start, we also recognise that there is much more to do across our health system to respond to climate risk, so that we can continue to provide quality healthcare, not just today, but into the future. We also know and recognise that this is an area that many of our staff care deeply about, and increasingly our community expects us to act upon. New South Wales Health is just at the start of our journey, so as we look to the future, we'll continue to work in partnership with our frontline staff, our key stakeholders, our New South Wales Government colleagues, primary care organisations, industry, research, innovation groups and suppliers to drive this work across the system and achieve a more environmentally sustainable footprint for future healthcare. We look forward to working and learning from many of you here today, and thank you again for the opportunity to share our unit's initial learnings and insights. Thank you.